What if your patient's Lyme disease treatment was not getting better, not because it was the wrong treatment, but it wasn't enough? So this is part of a Common Sense Lyme Disease series. I'm Dr. Cameron. I discuss cases or questions that come up in my practice. I had a patient who had been sick for 6 months. They had been discussing the word post-treatment Lyme disease syndrome. They didn't discuss whether there was a possibility of a persistent infection. Babesia had been discussed at one point, but the thick smear did not show any Babesia in the red blood cells. Eventually, the Babesia test was ordered. There was positive antibodies, and fortunately, with treatment for Babesia, the patient got better. Now, what is Babesia? Babesia is a parasite in a deer tick. It's right alongside Lyme, but you can't treat it with doxycycline without something for the parasite. It persists in the red blood cells for a week or two. Then after that, it still appears to be in the system. We know that because some people donate blood to the blood bank and the recipient gets Babesia. Also, it can show up in children who've had Babesia without being in the red blood cells that you can see under the microscope. It can be life-threatening in the elderly, immunocompromised, but in practice, in my practice, when I schedule an appointment, I'm concerned with the Babesia where it's not life-threatening, but still creates a chronic illness. So when tests are negative, we're talking about a parasite in the red blood cells, on a thick smear. But some patients only have antibodies, some have a PCR. In fact, not as many people has PCR as you would think, which is a DNA test. So there's antibodies to Babesia microti, which is the Babesia on the East Coast, Babesia duncani, which is on the West Coast, although Babesia can be seen in either locations of both types. But patients improve despite these negative tests, so I don't rely purely on these blood tests, although they are helpful in some cases. The treatment strategy for me is I avoid clindamycin, quinine, because there's more side effects. Years ago, doctors Krause and colleagues demonstrated that if you use tovacone and azithromycin, you get the same benefits without the side effects. 10 days was prescribed in the original studies, but that was based on the ability to clear the red cells of parasites. I find that I start with 30 days and continue therapy if I need to, and I base it on clinical judgment. There's a liquid form called Mepron and a pill form called Malarone, and even there, the Malarone can be 250/100 or 62.5. Now, even though the original research was on azithromycin and tovacone, I substitute doxycycline if azithromycin is not tolerated, or if I'm concerned with two other tick-borne illnesses, anaplasmosis or Bartonella. I haven't used tufenequine, which is Arcoda, very often, because if I get a good outcome with a tovacone, I don't need to go there. But I need to monitor QT intervals if I'm using azithromycin. So the cost of a tovacone is typically covered by insurance because it's generic. Once in a while you get an insurance company where they consider it a travel medicine and they don't cover it. But a good RX is an example where you can go and it's less than $80 in recent times using that plan. Malarone is more convenient than Mepron. Malarone is cheaper than Mepron. I use both the adult version and the pediatric version. The final takeaway is that even if you're treating Lyme disease, I always recommend that patients consider the Babesia, which is a parasite, and that if you treat Babesia, that patients who have been sick for some time have turned around and gotten their health back. So thank you for joining me for this Common Sense Lyme series, and have a good day.